Hi, good morning, everyone. Good to see you. Thank you for joining us today. We're good to go? All right. I want to start off on behalf of our government by saying we honor the sacredness of these lands that we're on and the importance of this land and the ancestors that once walked where we are all standing today. The Anishinaabe, the Cree, the Dene, the Dakota, the Métis, the Inuit, and the Anishinaabe nations who paved the way for what is now known as Manitoba, home to all treaty people. We share this information with you as a reminder of our treaty histories and the original homelands of these nations, which have become home to all of us here today. So I'm thrilled to be here as the Minister for Health, Seniors and Long-Term Care, joined by our Chief Provincial Public Health Officer, Dr. Roussin, Medical Officer. And today we're going to be sharing the work that our team has been doing to prepare for respiratory virus season to ensure that the system is best prepared for what we know happens every single year around this time. When I became health minister last October, almost exactly a year to today, right around this time, it became apparent that very, very early on, the previous government didn't actually take steps to prepare us for this season. I was shocked to learn in my capacity as health minister, again in the very beginning, that there were really zero steps that had been taken by the previous government to get us ready for the season that we know happens annually. And when flu season came around, when respiratory virus season arrived, which was the worst flu season we have seen in Manitoba in 2 decades, no plans had been put into place to respond. So you can only imagine my shock and concern to learn that the former government had taken no lessons from the pandemic, none. I pledged at that time to Manitobans that we would not find ourselves again in that rudderless ship, that we would ensure we take a different approach that is proactive and prepares the system. And so we began doing the work very quickly of working with our experts in the province, pulling folks together from across Manitoba to ensure that there are actual plans in place. And so I do want to make clear that we are taking a different approach, a proactive approach, so that no one has to wonder whether their grandparent, their parent, their child, or their loved one will have access to the care that they need. And that's what we're here, that's what Dr. Roussin and I are here to talk about today. We're here to share the information in terms of where our system is at, where our system is going, and how we're working together to make the system stronger for you. So I'm happy to share that we have increased acute care beds and ICU beds in the province. We've hired hundreds of new staff and we're training more consistently. And we've developed surge capacity and protocols and plans to ensure that there is care available for those who need it. We've taken steps to relieve the healthcare system of specific pressures to ensure that we can handle the increased needs for care. We're building up ICU and acute care beds throughout hospitals in our province. And so we've shared updates sort of throughout our journey here in terms of beds that we've added to the system. And I'm happy to share today that we have funded net new 18 ICU beds for a total of 110 adult ICU beds in the system. We've also funded new beds for the PICUs, so the pediatric ICU. We funded 8 new PICU beds, plus 4 step-down beds for a total of 21 beds. We've added an additional doctor at Health Sciences Center who started actually this past summer, started in July, and that allows for 2 physician coverage in PICU, which is already making a big difference. We've expanded the critical care nurse training program to include LPNs, and I want to thank all the LPNs who have expressed an interest and have joined that training program. And the next cohort for January is already 50% of the way full, and we do anticipate that cohort for training will be full. So in total, we've opened 112 acute care beds with a plan to open 70 more. We've also added 43 transitional care unit beds in community. Those are ALC beds that are beds throughout community that allow for folks to transition to personal care homes, that provides supports for folks who are maybe unsheltered or have precarious housing situations, different levels of care in community that allow for more bed capacity beyond the beds in the hospitals where folks need to be able to access them. In total, we have added almost 160 beds to the system. So when I talk about beds, we all know that beds are just beds if they're not staffed, right? That we need to have people on the front lines. And that's really what we're talking about when we're sharing these numbers around beds. I'm talking about staff that we've added to the front lines, staff who are at the bedside of Manitobans each and every day providing the care to you and your families that you need. Last month, we were very happy to announce that we've hired 873 net new healthcare workers to the front lines of our healthcare system. And that's really important work that will continue as we move forward in the weeks and months ahead. We have a target of 1,000 net new healthcare workers, and we're well on track to achieve that. But quite frankly, that work is going to continue, and we're going to continue to add hundreds and thousands of staff to the front lines of our healthcare system. I want to take a moment to acknowledge how critical it's been to work with frontline healthcare workers to do all of this preparation, to add staff to the front lines, to make decisions that reflect the needs in the system. I've had the opportunity to meet with critical care nurses, to meet with frontline staff, allied healthcare professionals, all folks who have made very clear that this type of planning is needed, and all folks that we're continuing to work with as we strengthen our plans moving forward. So I want to express my gratitude and my thanks to the healthcare workers who have been a part of this process, who will continue to be a part of this process. And I want to take a moment to thank those who have rejoined our public healthcare system. New grads who are on the front lines, but also folks who left the public healthcare system in recent years and who have come back and are now working again in our public system. I want to say thank you to you folks. Ultimately, we're all in this together, and we're working with each and every one of you folks on the front lines to make our healthcare system stronger, especially during this time of year. The last couple of points I'll share is that we've launched, as you can see in the posters behind me, we've launched our province-wide campaign to ensure that families know what they can do to prepare for this season. Vaccines for both the flu and COVID-19 are available throughout the province. And everybody has a responsibility and a role that they can play in making sure that our families, our loved ones, our friends, and our communities are protected and safe this respiratory virus season. And so, while healthcare workers take care of our most vulnerable and our sickest Manitobans, it is our job, each and every one of us, to make sure that we are doing everything that we can to protect ourselves, our loved ones, and communities from illness this season. And that means getting vaccinated against the most recent strain of COVID-19 and influenza viruses. So go out, get vaccinated. The line that we're using this year and that I've been using is 1 visit, 2 shots. Go see someone, your doctor, your nurse practitioner, pharmacist, and go and get your vaccines done in 1 visit. It also means that we have to practice some of the things that we learned during the pandemic, right? It means that if you're sick, you need to stay home. It doesn't matter what you're sick with. If you're sick, don't go out and see your grandparents. Don't hang out with the little ones and the babies in our lives who we care so deeply for. If you're sick and you can stay home, please do stay home. It means washing and sanitizing your hands frequently and putting on a mask if you feel like you might be fighting a cold or fighting something. Just put one on and make sure that you're taking those extra steps to protect yourself and those around you. These are all steps and important steps, tools that we learned during COVID, during the pandemic, and it's really, really important that we continue to practice these things in our daily lives. So again, I can't say it and emphasize it enough. We each need to do our part to protect the most vulnerable in our communities. And now I'm going to turn it over to our Chief Provincial Public Health Officer, Dr. Brent Roussin, who can speak more on the vaccine program in our province. Thanks.
Great. Thanks, Minister.
Thanks.
So as we continue to prepare for the upcoming respiratory virus season, all Manitobans 6 months of age and older are encouraged to get their free influenza and COVID-19 vaccinations. These are currently available in many medical clinics, access centers, pharmacies, vaccine clinics, nursing stations, and through public health. So we know that both influenza and COVID-19 vaccines are widely available now throughout the province, and it's especially recommended to those that are high risk of severe outcomes to get those vaccines and get them as soon as they can. Those groups that are of increased risk are those over age 65, who we would encourage to get the high-dose influenza vaccine, residents of personal care homes or long-term care facilities, pregnant people, children 6 months of age to 5 years of age, Indigenous people, as well as those with underlying chronic health conditions. So influenza and COVID cause a variety of respiratory illness symptoms, fever, sore throat, runny nose, cough, and can have severe outcomes in those that are especially at high risk. So that's why we encourage you to do whatever you can to protect yourself by getting both of those vaccines as soon as you can. We know that these illnesses are spread when aerosols are created from people who are ill, either speaking, coughing, sneezing, can be spread through touching surfaces and then touching our face. So that's why hand hygiene is so important as well. So there's a number of measures that we can take to protect ourselves. And certainly, like we were discussing here, is stay home when ill. We know that these are spread from people who have symptoms, and the best way to protect people around us is to stay home when ill. Washing our hands frequently, coughing, coughs and sneezes, wearing a mask if you have any symptoms or if you're in around people who might be more vulnerable. Consider wearing a mask, especially indoors, and in disinfecting commonly used surfaces. So again, vaccination to both COVID-19 and influenza is one of our best ways to protect ourselves and the people around us. Staying home when ill, especially avoiding those people who are at high risk of severe outcomes, and plenty of hand hygiene is our best way to protect ourselves. So certainly if you are at risk of severe outcomes or having significant symptoms, you can call your healthcare provider, you can call Health Links, and they can provide some advice on the next steps for you. So more information on all this is at www.manitoba.ca/vaccine, and you can help learn some more about where you can access some of those vaccines. So thank you very much. Thank you, Minister, and happy to take any questions.
Great. Thank you so much, Dr. Roussin. We'll open it up to you folks for questions.
Because you spoke, Minister, about last year being a particularly difficult year for the flu season. Do you have any projections for this year, and can you speak to what made last year such a challenging year?
I can offer a few remarks, and then I'd hand it over to Dr. Roussin to speak more on that. We knew for several years, back in 2019 actually, that respiratory virus season was putting increased pressures on the system. Then obviously we navigated a pandemic, and when I came into this role last year, I was really shocked to see that there were literally no plans in place whatsoever by the previous government. They hadn't taken any steps to work with experts across our healthcare system to build more capacity. They were cutting beds from the system when we should have been adding beds to the system and adding people to the front lines. And so for us, our focus has been on adding capacity to the system, knowing that this is cyclical. This comes around the same time every year, and that we have to be better prepared. And we also know the steps that we've taken to date don't represent all of the steps that we're going to be taking. There's more work for us to do. There's more capacity we're going to continue to add as we anticipate, what we see every year are increased pressures on the system. And we want to make sure the sickest Manitobans have access to the care that they need in their province. In terms of what the season we anticipate will look like, I'm going to turn that over to Dr. Roussin.
Sure, yeah, and so that's always difficult to predict. We look to the Southern Hemisphere for some clues to this. Southern Hemisphere is seeing what we would call a fairly typical respiratory virus season, influenza A, RSV, as well as COVID-19, but not seeing anything unusual in the patterns there. Now, that doesn't necessarily always translate here. Last year, our severe outcomes were driven largely by influenza A, where we saw a lot of transmission, but we saw that for whatever reason it was quite virulent. So we saw many severe outcomes with it, but did have a fairly good match with the vaccine last year. And so unfortunately, the people that we saw in our ICUs and those with the severe outcomes, almost none of them had received the vaccine.
Do you have stats on uptake for the COVID vaccine thus far? The latest rendition?
Oh, it's really, really early at this point. We receive weekly input from long-term care facilities right now just to ensure they're on track. Our weekly respiratory virus report is out, and that'll be out updated on Friday. So take a look there. We'll have updated numbers. But there is a bit of a data lag as the vaccines are administered and then into that system. So it'll be a number of weeks before we start seeing those the high uptakes.
Part of the reason why we're here today is to make sure that Manitobans know the vaccines are available, that they know it's important to go out and get vaccinated right now. This isn't something that folks should delay. They should go out and make sure that they're getting their vaccines as soon as they possibly can, and that there's a number of ways you can go and get your vaccine, right? There's a number of primary care providers you can go and see. We've opened up extended hours clinics so that if you can't get your vaccine, let's say Monday to Friday, 8 to 4 p.m., that's okay. You can go to the extended hours primary care clinic at the Grace. That's just as one example. You can go there in the evenings or on weekends, and you can get your vaccine that way, and you can bring your kids and your loved ones to get vaccinated as well. So I can't emphasize it enough. Now is the time to go and get vaccinated. Do not delay it. We can make sure that we protect ourselves. We're taking these proactive steps to also protect the healthcare system and make sure that we're mitigating the spread of illness this season.
Last year, Dr. Roussin, what was the uptake for both, the flu vaccine and COVID?
Yeah, for the flu vaccine, we saw roughly 25% overall for the population. It was, certainly higher for those over age 65. And for COVID-19, we saw about 19% uptake.
Obviously, you want more than that to get vaccinated, but looking back at last year, is that a decent numbers for you? What are you hoping for this year?
Yeah, and so if we look at the pre-pandemic era, our influenza uptake was maybe around 21%, and so we've seen that gradually increase over time. And so what we're really concerned about is the people who are at high risk of severe outcomes. So last year for influenza, we actually saw a decrease in children under age 5, the proportion of them who got vaccinated. So we really want to focus on that because we know that's a very high risk group. And then of course those at the higher age levels and as well as underlying medical conditions. So like we mentioned, when we looked at the ICU admissions last year related to influenza, almost none of them were vaccinated, but almost all of them had very significant underlying health conditions. So we had that missed opportunity there to protect the Manitobans.
You have a target for this winter?
We don't typically look at the target in the as far as percentages. Certainly, we want to see them increased from last year, and we really want to see those high risk groups receive that vaccine. And so, the healthcare system is always a great partner, and we've really emphasized that. Let's take every single opportunity, every contact we have with a patient this year, and offer them those vaccines. So let's not miss any opportunities, and we have a great partner throughout the system.
Regarding the bed, how were you able to pull out more bed for this current year? How was the process done? Which resources did you gather, etc.?
Yeah, that's a really, really great question. So as I stated, we've added nearly 160 beds in total to the system. It's a tremendous undertaking. It's much easier to cut beds than it is to add beds. And we've seen the impacts of the previous government cutting hundreds of beds from our healthcare system, but we're also seeing the benefits of our government investing in adding more beds. Hundreds of beds is the target to the healthcare system. This work is done in partnership with folks on the front lines, with experts and health leaders, and we have many more beds that we want to bring online in the coming weeks and months, and we're going to continue to add beds to the system as we progress in the years to come. So these beds, again, aren't just beds. These are people that we're talking about. A bed is just a bed unless it's staffed with the healthcare professionals providing care to Manitobans at the bedside. And so when we shared that we'd hired a net new 873 Manitobans in the healthcare system, those are folks who are working the beds that we've added. And we're going to continue to hire folks to staff more and more beds as they come online.
Dr. Roussin, I'm curious with the uptake with the COVID vaccine last year, did you see the same pattern with under 5? Was there a drop in uptake?
Well, typically with the COVID-19 vaccine, we've had a very low uptake in that age group anyways, so I don't have those numbers with it, but with influenza in those younger age groups, that we see that increased risk and typically had a fairly good uptake. Last year we saw that was probably one of the only age bands that we saw actually a decline in uptake. So we want to get that message out that we really encourage both COVID and influenza vaccines, but in those young groups, certainly influenza vaccination is important, and really encouraging people to get vaccinated and get vaccinated early.
Are you concerned about misinformation about vaccines? I know it's particularly common in parent groups. It's spread a lot online amongst young moms, new moms.
Yeah, so certainly misinformation and disinformation is a significant risk for public health and for the healthcare system, and it's always been an issue. But we saw during the pandemic, it's grown exponentially, and so we want to continue to be the trusted source of information. We want people to understand that their healthcare providers are there and they're great sources of information. So if you hear something or you have any questions, you have a great resource right there that you already trust in many aspects of your life. So continue to trust them, reach out, ask them, and really try to get the information from trusted providers.
And Minister, are you able to speak a bit more to the latest PR campaign here? So with what will this entail? Posters, ads?
All of the above. So posters, ads, radio, social media, of course. We know that a lot of folks get their information now from social media. And as Dr. Roussin stated, it's really important for us as a government and myself as the Minister for Health to make sure that we're doing our part to share accurate, up-to-date information for Manitobans. And so this campaign is really about making Manitobans aware that vaccines are available, that you can go out and get vaccinated right now. I can't emphasize enough, don't wait. Go out and get vaccinated today. Get your loved ones and your kids vaccinated right away. And take the steps that we know we can take and we need to take to protect ourselves and those around us. And the healthcare system, quite frankly. So you're going to be hearing radio ads, you're going to see ads on social media. You're going to see me with my sleeve rolled up, getting my 2 vaccines in one visit, maybe 3, because apparently I need tetanus now as well. I'm due for that. So I'm going to make a point of making sure that we're being vocal, that we're being visible about the importance of getting vaccinated. Dr. Roussin's already said we want to see those numbers increase. We want to see higher uptake. And we know that vaccines are effective and that they're safe. And so we're going to keep sharing this message, and hopefully folks see the information in whatever form meets their needs and they take that next step.
How much will this ad campaign cost?
I'm not 100% sure. We know that we've always budgeted as a government to make sure that we have the resources to allocate responsibly, especially when it comes to vaccines and public health. We can get you specific numbers on that. But certainly, our priority as a government is making sure that we're investing in Manitobans being able to have access to the healthcare and the information that they need. So our responsibility is getting the information out there, listening to the experts that we have in our province who this is what they know, this is what they do. And as Dr. Roussin said, making sure that folks know to go and ask questions to the folks that you trust with your healthcare, get the answers you need so you feel confident in your decision to get vaccinated. And encourage everybody to get out as soon as you can, get your vaccines, go to one of our newer clinics, the after hours, extended hours primary care clinics, maybe a minor injury clinic, and get your vaccines.
Dr. Roussin, can you speak to sort of the COVID situation right now? What strains are circulating?
Yeah, and so we're seeing the subvariants, the KP subvariants, which are been circulating here and dominating here for quite some time. Not bringing with it an increase in severe outcomes, but we certainly saw a lot of transmission over many of the summer months and continued now at rates very similar to what we saw last year at this time, but not seeing that translate into increasing severe outcomes within hospitals.
the COVID vaccine now, does that respond well to that subvariant?
It is the KP subvariant that's in this updated vaccine, so we do expect it to have good immune coverage.
Do you have one question on Zoom? So, Minister, if you could just speak into the mic.
Oh, sure. Let's go to Zoom for the question.
Yes, up first and only, Victor from Radio Canada. Victor, go ahead. One question, one follow-up.
Yeah, sorry, I'm here. Can you tell what is the current bed occupancy rate currently in the Manitoba hospital?
Yeah, thank you for your question, Victor. So our occupancy rates in Manitoba have been hovering really around 80%, I would say, pretty consistently. We can get you more clear data on that, but what I would say is, part of the reason why we're adding this bed capacity and we're making these investments as a government to add more beds to the acute care system and the critical care system, ICU beds, is because we know we lost hundreds of beds under the previous government, and cutting all of those beds put additional pressure on our system and contributes to occupancy rates being higher than what we'd like to see. And so certainly during respiratory virus season, we know that occupancy rates can really skyrocket, and we need to make sure that we have more capacity, which is why we're adding people to the front lines. We're adding physician coverage to PICU, and we're going to continue to add beds as we move forward to address occupancy rates. But to really, it's fundamentally about making sure that Manitobans can get the care when they need it, where they need it in the system.
Thank you. And my second question is, how many doses of COVID and flu vaccine will be available this year?
We order significantly more than we typically use, so supply is never an issue with influenza and COVID at this time. So the Manitobans are encouraged to just go get your vaccine now, as soon as you can, and we have adequate supply to provide to everyone who will want.
A specific number?
I don't have a specific number. We typically have many more vaccines than people take us up on, and so we encourage more and more Manitobans to get vaccinated.
Thank you.
Okay, this concludes Zoom. We'll throw it back to the room.
Dr. Singh, question for you on a bit of a different subject about the Senate bill being passed last week that includes the free diabetes medication. So wondering, as Chief Public Health Officer, what would the availability of free diabetes medication mean for the health of Manitobans?
Yeah, and so certainly diabetes is a significant driver of ill health in Manitoba, and we remain quite concerned with the rates and the complications that associate with it, and so the financial access to medication is certainly important, right? Certainly necessary, but it's not sufficient, right? We need to ensure these people who are living with diabetes have access to care, to the support systems, and as well as looking at ways to address the drivers of ill health, those underlying determinants that we see over time. So it's a great step. Right, it's necessary, but it's not sufficient. It provides that financial access to many who may not have had it before, but we want to ensure we're providing care throughout their life course.
What I would add to that is, here in Manitoba, we have one of the most comprehensive programs for diabetes coverage in the country. And so the federal government making moves and taking steps around pharmacare obviously is a positive. The areas that they're looking at, we've taken steps here in Manitoba, including providing universal coverage, free coverage for birth control. We've taken some significant steps as a government here to make sure that Manitobans have the coverage and the access to care and medications, supplies that they need. And, that conversation with the federal government is an important one and ongoing, and we hope to take steps that prioritize what Manitobans need and what's in the best interests of our constituents in this province.
Regarding you said you hired 873 new health workers. First, how did you achieve that? And then perhaps how do you expect to reach the thousands? And if so, when exactly? Do you guys have any sorts of schedule regarding that?
Sure, that's a great question. I appreciate it. We We set a really ambitious target. 1,000 net new healthcare workers in our budget year is very, very ambitious, but we were clear when we announced that target that Manitobans deserve an ambitious government. And how did we achieve the 873 net new? Teamwork. It's an approach, an all-hands-on-deck approach. We're working with our partners in the healthcare system. We sent a letter to healthcare workers from day one, letting them know that we respect them, that we're here to listen to them. And we embarked on a listening tour where we've heard directly from folks on the front lines of our healthcare system what they need to see happen, including doing the work to changing the culture in healthcare. So we've worked with our partners, colleges, post-secondary institutions. We have taken very, very real steps to make changes that allow for folks to return to the public healthcare system, and we're seeing the uptake, whether it's returning nurses or other folks. And we've also stood up a recruitment and retention office. So the RRO has been working tirelessly since we stood it up in May to streamline the way that we do recruitment and retention in Manitoba, including supporting internationally educated healthcare workers. And so, like I said, it's an all-hands-on-deck approach. Staffing and healthcare human resource is a national challenge. It's a challenge here in Manitoba. Manitoba was late to really getting into this space in a meaningful way, and so our government hit the ground running in terms of doing this work. And we do anticipate hitting our target of 1,000 net new healthcare workers within that year, but that's not good enough. You know, there's more work that needs to be done, and we're going to continue to work each and every day to add hundreds and thousands of staff to the front lines of our healthcare system so Manitobans can get the healthcare they need where and when they need it.
RSV vaccines, Minister, Ontario and Quebec making steps for newborns and infants, Ontario for high-risk seniors as well. And any progress in Manitoba on moving towards that direction?
Yeah, I'll hand it over to Dr. Roussin to provide a bit more information on that front, but we've introduced that opportunity here in Manitoba, and we're taking important steps to make sure that more folks in our province are protected. And again, you know, we're rolling out, and we've rolled out a campaign to ensure that Manitobans have the information, that they know it's important to go out and get the vaccines right away that you're eligible for, and to have those conversations with your primary care provider to make sure that you're making informed decisions right away. Go out and get the vaccines that are available and appropriate for you. But I'll hand it over to Dr. Roussin to provide a bit more information on that front.
Sure, and with the infant program, we continue to have a high-risk infant program for RSV with palivizumab. So that's run through Child Health and really protects the most at-risk children for RSV. And as we move forward, we're going to continue to look at ways to expand that in the upcoming seasons to provide bigger protection. And then the RSV vaccine, we are providing that within long-term care facility, those 60 plus in long-term care facilities. So again, those most at risk for severe outcomes are going to have that opportunity to protect themselves this year.
And when did that start? Sorry if I didn't catch that earlier.
That is just this year, just weeks ago, as we start our prep for respiratory virus season this year.
Okay. Thank you again, everyone, for joining us today, and thank you, Dr. Roussin, for just being obviously a beloved expert in this province, and for working with our government to make sure that we're taking steps to be proactive and to plan and prepare our system. And I can't say it enough. Go out, get vaccinated, do not wait. Make one visit, get 2 vaccines, 2 shots, and protect yourselves, your loved ones, and communities this season. Take care. Thank you.